Hi, my name is Avery Robidoux, and I'm going to scan my area real quick before we get started. This is my desk. I have a sewing machine under here. This is my dresser, and this is just some clutter I have over here by my door. Okay, I don't have anything on my hands or wrists. My name is Avery Robidoux, and I am going to perform the skill check off sterile gloving. And I'm going to state the 12 practices, the 12 safety practices. Step 1 is to verify the care and order of the client. Number 2 is perform hand hygiene before and after providing care or handling supplies. Number 3 is I'm going to verify the facilities, policies, and procedures, and to assemble equipment and supplies if needed. Number 4 is to consult manufacturer's recommendations when equipment is involved. Next, I'm going to knock before entering the room, and then I'm going to identify the client with 2 identifiers. Next, I'm going to notice the overall condition and health of the client. And then I'm going to explain the procedure and to provide for privacy. After that, I'm going to raise the bed for good body mechanics. And then I'm going to don PPE if indicated. And then after that, upon completion of the skill of the procedure, I am going to lower the bed and apply side rails per client's care plan. And I'm going to place the call system within reach. And then last but not least, I'm going to observe for any abnormal findings, and if there are any abnormal findings, I'm going to report it to the charge nurse immediately. Okay, now I'm going to get started with my skill. So I have my wound dressing kit, I have my gauze, I have my sterile gloves, and I have my saline. I'm going to bring my wound dressing kit in front of me. I'm going to open it up like this, and I'm going to turn it. And I can touch the 1-inch border, margarine border. I'm going to bring this over, and then I'm going to bring this towards me. Now I'm going to tilt it a little bit, using only the edges. Now I'm going to grab my gauze. I'm going to open it up, put that on there. I'm going to set this aside. Now I'm going to take my saline and I'm going to douse it all over, however much is needed. Now I'm going to bring this to the side. Ideally, if I were at the college or I were into a nursing facility as a nurse, I would make sure that the table that I'm working at is above my waist and below my shoulders. And I would not bring my hands above my shoulders or below my waist. Now I have my sterile gloves. I'm going to open it. And I'm going to take it out of the package. And I'm going to set this aside. Now I'm going to open this. I'm going to go into the borders and open it. I can only touch the 1-inch border with my hands. I'm going to reposition this so you can see. I'm going to put on my right glove first, my dominant hand, and I'm going to grab the cuff. Something is flip-flopped around here. I'm just going to switch these. Okay, I touched the cuff. I'm not going to stop it. Now I'm going to take the cuff of this one and I'm going to slide my hand into it. Only touching the cuff. Now I'm going to grab the inside of this glove and I'm going to stick my hand into it. And there I have performed the skill check off sterile gloving. Now, if I had done my procedure already, what I can do with my gloves is that I can pick this up and I can take it over and trash it. And now I'm going to bring this over, make sure that I'm touching only the inside. My finger is right here. My other finger is right here, not towards the edge of the border. And then that way I can do what I need to do. I'm not going to raise my hands above my shoulders or below my waist. And once everything is completed, what I'm going to do is I'm going to take off my gloves. I'm going to grab in the center of the glove, pull out, grab this glove with this hand, and I'm going to go inside and then dispose just like that. And then I would wash my hands. Skill complete.